The statistics that I kept track of as a health journalist, just continued to get worse from the time I began publishing the magazine in 2001 till when I left in 2016. And those numbers, if you can imagine a chart with 100% of the US adult population, like 100 little figures, when I started seeing more than 50% were already diagnosed with a chronic illness, and many more who had chronic illnesses just hadn't been diagnosed yet, that started really freaking me out. And we started seeing the numbers, obesity and overweight and inflammatory disease states, 60, 70% of people overweight or obese at any given time. 80% of people not mentally and emotionally thriving, a number that climbed from the time I wrote my book to 89% during the pandemic. And this was the one that kind of blew my mind. After all of the kvetching and the shaming and the pressuring and the shoulding about healthy habits, eating well, exercising, 97.3% of US adults as of 2016 were not practicing even the foremost basic habits that would be necessary for them to be healthy and happy and on track to stay that way. And when I started looking at the research behind that number, which was published by the CDC and the Mayo Clinic proceedings, it was pretty legit. It's a smaller study, it's localized, but people seem to be thinking it's pretty accurate. It's like, well, wait a minute. That's a single digit percentage of the population doing those things. And they didn't consider stress management. They didn't consider sleep, and they didn't consider social connection. And like, because you're talking about loneliness, that is one of the most important factors in our resilience and our vitality. Is, are we surrounded by a supportive community of people who'd have our back if we needed them, or just there to talk to and like check reality with sometimes? If you consider that not even a single digit percentage of people is doing the four things that the Mayo Clinic said are important, like eating a reasonably healthy diet, getting enough exercise, and not smoking. How many people do you think are doing all of those things and also managing to get enough sleep, managing stress, and being surrounded by social support? And I was like, there's no way it's more than 1%. And that, to me, really became the essence of the problem. How do we have a functioning culture when fewer than 1 out of 100 people is healthy and happy and on track to stay that way, and everybody else is suffering some chronic level of misery or illness or less than full octane capacity?
Greetings, Carl here. The clip that you just watched with my friend Pilar is part of the worldwide chapter meeting that I hold as part of the membership program. And it's for financial advisors who understand and are committed to the massive, massive impact that they can make in the world. We meet once a month, and to get your invitation and to learn more about the membership program and Pilar's work, just hit the link below.